Good afternoon, everybody on the East Coast, and good morning if you're on the West Coast or somewhere in the middle of the country. Thank you for joining us today for our inaugural informative webinar session, this one being on long COVID. And just to let everybody know, we are going to be having future ones. Our next one will be May 20th. So if you know anyone that might be interested in joining then, or you want to learn more, I will put the link in the chat for that. And before I introduce myself and who I am, I'm going to just let everybody know that this is being recorded. This is not to share your information externally or to store it anywhere, simply to be able to share the webinar with you if you weren't able to attend fully or would just like to watch it again later on. So just letting everybody know that it is being recorded. Nobody can see you. You'll just be able to see us. If you have any questions, please put them in the chat and we'll be able to answer them. So my name is Agatha Arameo. I am the Executive Director of the Foundation for Total Recovery. This is a 501c3 nonprofit established by Dr. Gary Kaplan in 2015 to help educate the medical field on immune-mediated chronic illnesses, just to better teach our medical field that sometimes doesn't have all the answers on that, as you might know. And I will be introducing our two hosts for today. So today we have Dr. Gary Kaplan, who is the medical director and founder of the Kaplan Center for Integrative Medicine. He is also the author of two books, one of which being called While You Are Still Sick, which we will be raffling off 2 autographed copies of today, so stay tuned for that. He's also led 3 symposiums international with some of the top researchers and doctors in the world, actually, on immune-mediated chronic illnesses. We are currently planning another one that will be much smaller, so details on that to come. And we are also joined by Nidhi Riva, who is the director of the Long COVID Clinic here at the Kaplan Center. Nidhi is also the recipient of the Arlington COVID-19 Hero in 2021 for her efforts in helping mitigate any COVID-19 health issues in the community. She's also the founder of Nested. This is a company that serves to educate expectant families and provides life-saving skills to better serve communities. And before I kick it off to our presentation, also letting everybody know our format for today. So we're going to start off with a high-level informative session on long COVID from them, where we're at now, what they know, they are the experts, so it's definitely valuable information. And then will be followed by our Q&A session, which should be about 30 minutes. But before we begin, we're going to actually kick things off with a poll, just to get a lay of the room. Again, I want to let everybody know your information is not being shared or stored. This is just to get an idea of who's in the room with us and how everybody's feeling today. But do you think or know that you have long COVID? So I'm going to let some time, just a minute, like go by to answer that. But a little fact here is oftentimes a lot of long haulers who do have long COVID didn't even know they have it. They didn't have any symptoms from initial COVID-19 infection. Their symptoms didn't appear until weeks or months after infection. So it's a really, really tricky virus that we'll learn a lot more about today. Lots to learn on it. So give another few seconds for that until it seems like things trickle down. All right, so it looks like about 27% here know that they do have it. Half of the room says that they do not have it, probably just curious. There's a few that aren't sure, and then there's someone here that thinks they might. So hopefully today you get some answers. All right.
All right. Well, it's such a pleasure to talk to all of you and talk about something so unbelievably important. So, what is long COVID? It really is a chronic condition that occurs after having a COVID-19 infection. We generally see symptoms that go past 6 weeks after your initial infection. And the complicated thing about this is your symptoms can be mild to severe, um, and it's really individualized per patient. You can have just 1 or 2 symptoms, or you can have a whole host of symptoms that really impact your life. It also can impact, your lungs, your heart, your digestive system, um, you know, uh, a lot of organ systems, and that's why it can be really hard to recover from. As far as general symptoms that are very common is fatigue, chronic pain, brain fog, digestive issues, and neurological and cognitive difficulties as well. So the next slide, we're going to talk about all the types of symptoms that patients often complain about in regards to COVID. So as it says, as I said before, there are a lot of systems that get impacted. Oftentimes, patients feel feverish or they feel like they always have the chills, even though they might not actually have a fever. Oftentimes, patients are dizzy or feel very lightheaded, especially if they're sitting to standing. A lot of us know about the common sign of losing taste or smell, um, but oftentimes patients have ringing in their ears or they have sensitivity to light and sound. That's also something that really is, debilitating in their life. Cough or shortness of breath, palpitations, chest pain, these are all symptoms that go along with long COVID. Some patients have musculoskeletal injuries. So, for instance, they have muscle soreness or joint swelling that can sometimes happen with COVID or long haulers. Sometimes patients will have diarrhea or constipation or some intolerances to certain foods that worsen after having COVID-19. These also can be very challenging for patients. But oftentimes, patients come in because they feel like they're having trouble concentrating, that they have brain fog. They have trouble remembering things that normally are very easy for them to remember. Or they feel like their anxiety and depression has worsened after getting sick. So these are kind of, an overview of the symptoms that patients oftentimes come in with.
So if you're going to look at the number of people who have long COVID, the answer is unfortunately a lot. All right. So at this point in time, the estimate by CDC is that we got about 5.3% of the US population struggling with long COVID. And a lot of these people are severely disabled. I mean, we're talking that they've had to leave their jobs, that they are pretty much homebound, or they've had to radically cut back on their activities and what they're able to do. It's a disease which is affecting a large number of people around the world. And it's costing us a bloody fortune in terms of care for these individuals, as well as treatment for these individuals. The challenge with long COVID and the blessing of long COVID is that it finally drove a lot of research dollars into studying what we've been seeing in many other conditions. And so if we put up the next slide, we talk about long COVID as a rogue virus. The reality of the matter is it's certainly a novel virus. It's a virus that our systems had not seen before. And so what did us in initially was our immune systems. Our immune system way overreacted to this because it had no idea how to respond to this. And in the process of doing so, it got confused. What do I mean by confused? It started to attack us. So the virus was a problem unto itself, and the virus creates enough of the illness, but the immune system and our response to it was way overreactive. Now, this is not a unique phenomenon. It is what we see in chronic fatigue syndrome. It is what we see in post-treatment Lyme syndrome in a lot of cases. It is what we see in PANS pandas. And it is frequently what we see in people who are struggling with treatment-resistant depression, anxiety disorders, OCD. So, and now we're beginning to recognize that these viruses can trip off an immune response that can cause Parkinson's, and can cause ALS, and can cause Alzheimer's. So the unique gift in disguise of post-COVID and COVID itself was that it brought a lot of research efforts into this and said, wait a minute, there's a commonality to all this. The commonality to all this is what's happened to the immune system. Now, there are other things, however, because what we see is a lot of people getting sick who were previously very healthy, as well as those who've had mild cases of the disease. So the severity of the disease post-COVID is not tied in necessarily to the severity of the disease you had initially. Now, certainly we see a higher percentage of people who have had severe disease have long-haul COVID, but we also see enough people who have had a relatively mild disease end up with long COVID, and we certainly see it happening in children. So this is not a phenomena that is well defined in terms of the severity of the disease, nor is it specifically well defined in terms of the age of the individual who develops it. But it is something that we have seen repeatedly over the decades with other illnesses. And so now we're coming back around to a different understanding of how these systems interact with how these viruses and bacteria and spirochetes interact with our immune system and cause our immune system to get very confused. There's two big pieces of the immune system. There's the acquired and the innate. Innate side is your first responders, and how the first responders may act may set off. We see in some people with post-COVID where the spike protein has damage, what's called the non-classical monocyte. And in those individuals, we see a cytokine panel. And if we don't test that cytokine panel, we're actually not going to be able to see the problem. And so when we test the cytokine panel, we're able to see that there's a ratio of certain cytokines developed by Bruce Patterson that are abnormal and significant for this non-classical monocyte. The beauty of that test is it gives us a very specific way to go about treating things. But COVID becomes a very difficult problem. Is there are some people in which there is now evidence there's persistence of the disease, that is persistence of the disease in the bloodstream, and we're developing new tests to begin to measure that persistence of the disease in the gastrointestinal tract. So we see this wide range of diseases, and in those individuals, we actually may want to go after the disease by giving them an extended course of Paxlovid. But as we begin to understand the disease, what we're beginning to understand is how to not just treat this disease, but how to treat other diseases with very similar problems. ME/CSF, I mean, the overlap in pathophysiology of ME/CSF, as demonstrated by Vinajnath work at NIH, is remarkable for its consistency. And so this has given us a window into how to diagnose, treat, and what our targets become for a number of other symptoms, other diseases. The other challenge, of course, is that different people get different manifestations of the bug, as Nidhi was talking about. The big three symptoms are fatigue, post-exertional malaise. Post-exertional malaise is about doing a relatively minor activity. It can be reading, it can be cleaning up the house, and then you crash. And by crash, you need to lie down. You have not got any energy to do anything else. And that can last anywhere from hours to days to weeks. Brain fog, difficulty with focus and concentration, unrefreshing sleep, memory problems, comorbidities with anxieties and depression. These show up in over half the people. Fatigue is showing up in 88% of people with post-COVID. Okay, malaise, the post-exertional stuff is in 80% of people with post-COVID. The brain fog, 80%. Unrefreshing sleep, 75% of these individuals. So, we're seeing lots of problems that overlap with other diseases that we see, which makes sense because now it helps us understand what's going on with the body and how to respond to those. So that's kind of a big overview. There's a lot of information there, I know. We'll take it apart through the question and answer period.
So just like as Dr. Gary kind of talked about, this is very complicated. So the path to treatment is actually, making a personalized plan for our patients. And what we know is that, rarely is, a chronic condition because of one event. It's normally because there's been an accumulation of things going on with the body for some time. So if you think of a Jenga puzzle, you think of that as being, strong and upright, and that's kind of your health when it's healthy. But as we start living life, and if you have a car accident or you're taking certain medications, you have, some kind of a trauma, you have asthma, you have an autoimmune issue, what ends up happening is that they're generally, COVID tended to be the one thing that happened that kind of had everything toppled down. But it's because our immune system had been challenged, because there are a lot of things already going on with it. So path to treatment means that we come up with an individualized plan for patients that looks at their entire body. So we can, so we'll talk about kind of the path forward for patients. So the treatment types that we like to talk to about patients is, food is medicine. So working to heal your gut. Like Dr. Gary said, we're seeing a lot of data showing that the COVID virus lives in our stomach lining for years. And what ends up happening is that 70% of your immune system is in your intestines. So healing your gut through nutrition is going to be an important part of healing, as well as psychotherapy if there's been any significant traumas that have happened in your past, or just, it's difficult to deal with chronic illness. So, anxiety and depression, these are all things that can be helped with the therapy. We have IV therapy that is really helpful for patients. We use different agents like glutathione. We also use NAD. This also helps with mitochondrial function and boosting that up so patients are more capable through their transition. We also work with physical therapists that are highly skilled to help with a lot of the body ailments. They also help with migraine and headaches and, muscle spasms for patients, as well as pelvic floor issues as well. So medications, we use antivirals. We use different supplements. We have different COVID supplements that help to try to boost the immune system, as well as improving your mitochondrial function. And we oftentimes use Paxlovid as well to help with that residual virus. Acupuncture is, something that we have a very skilled herbalist and acupuncturist, and she's wonderful in helping patients with their nervous system to help them ground. And it's another modality that's really, really useful for long COVID patients.
So treatment process really has to be pretty comprehensive. There's a group of people who get sick and with relatively minor intervention get better. There's another group of people who get sick and it is the end result of, as Nady was talking about, a weakening of the system that's been occurring over years. So the very first thing we have to do is a very thorough evaluation. History, history, history. I want to know not just when you got sick. And the thing that I love is that my question to patients is, when was the last time you were in excellent health? And the very first thing most patients do is they lie to me. I was last in excellent health until I got COVID and I've been sick since. Fine. You're now, 22 years old. You got COVID when you were 20 and that's been the problem. Now let's just go through the rest of your history. Well, okay. I've had migraines since I was 12. I've had problems with 3 or 4 concussions in the past. I've had problems with severe menstrual irregularities and dysmenorrhea. And now we're starting to get a picture of somebody who maybe not have been in excellent health all through this time. But, the beauty of youth is you compensate for lots of things and you keep pushing through. I've had problems with insomnia since I was 15. I've had problems with, they'll admit to finally acknowledging traumatic events throughout childhood. PTSD is a big problem, and it can occur both as a result of interactions with the medical system, unfortunately, and certainly I see that in a lot of my PANS-PANDAS patients, but it can also occur as a result of child abuse. And these things we know weaken our immune system and set us up for. So we've got to get this history, and we've got to find out, have you been exposed to heavy metals? Have you been exposed to molds and other toxins that potentially weaken your immune system? Mold toxins in particular are neurotoxins as well as immunotoxins. And so they leave the system weakened and susceptible. So we need to get a very comprehensive picture of the individual we're dealing with in order to be able to formulate a proper treatment plan. The next step is, as a result of all this information we've taken in and a proper physical, we then start running tests. And then which tests do we run? Well, a lot of the times the people we see, the testing they've had done has all been normal. If you're sick and all the tests are normal, the answer is we haven't run the right test yet. So then we start looking at other things that are consistent with the history. For instance, if there's a history of multiple tick bites, but no quote unquote history of Lyme disease, we're going to want to ask whether or not that's a possibility. Now, there's an interesting thing when we do a cytokine panel. The cytokine panel gives us a ratio that should, if it's over 0.7, it indicates that you actually have long COVID as a result of a functioning of a specific part of the immune system. But if that result is over 5, and in some people we've seen it as high as 100, it's more suggestive that we're looking at tick-borne diseases. And so we have asked through a series of questionnaires and a comprehensive history, we start to get a picture of whether or not you're at risk for those, because some of those diseases have laid latent in your system, and if not addressed, you're going to be sick for the rest of your life. And so we need to look at those systems as well. We need to look at how well your immune system is functioning. So we do a lot of different testing that is both stuff we can do within the system, that is by Quest or LabCorp, and there are a number of other specialty tests that we have to do outside of the system that may be done in terms of Lyme testing or in terms of heavy metals or mold toxicity testing. So it can get pretty comprehensive, and unfortunately can also get a bit expensive because a lot of the stuff isn't covered by insurance. Nevertheless, the goal is, how do we get you better? What can we do to help you recover? And then once we've got all this information compiled, we then turn around and say, okay, here's what we have. Here's what looks like the best treatment plan for you. And that can range anywhere from, let's put you on 2 weeks of Paxlovid, because in a percentage of people, we put them on 2 weeks of Paxlovid and they're done. Okay, this is now well documented in the literature. And so a percentage of our people, let's go the easy route. Another percentage of our people, we're going to have to be looking at treating if we find the cytokine panel is appropriately abnormal, then we're going to be using a combination of something like Maraviroc and Pravastatin, and possibly low-dose naltrexone in order to reduce the inflammation of the central nervous system. There are supplements that can be used. CoQ10 has been demonstrated in a couple of studies to be effective. If you're over the age of 40, UBQH is the better of the two of those. We can also use melatonin, which has also been demonstrated to be effective in several studies for these conditions. We look at COVID now, in one study demonstrated that there were probably 4 subgroups and clusters, and these are consistent with what we have seen. So we've got some people with multi-system disease. That is, it's affecting their brain, it's affecting their gut, it's affecting their lungs, and you've got migraines, and you've got depression, and you've got fatigue, and so that's one group of people. The next group of people has POTS. This predominant symptom, post-orthostatic tachycardic syndrome. POTS is an issue of where you stand up, you fall down. So what happens is you stand up and the autonomic nervous system isn't working right, and you suddenly develop lightheadedness, really racing heart rates. And then you can't keep the column of blood going to your head enough, and you may pass out. So looking at that, that's another subcluster that can occur and can develop as a result of COVID because of its damage to the nervous system. A third cluster of people, and by the way, a number of those people also have MCAS. So this is where we see dysfunction of the eosinophils and a release of histamines and other factors coming from that part of the immune system. They can also develop problems. They can also have a history of Ehlers-Danlos syndrome, which seems to be one of the susceptibility factors in some of these people to developing long COVID. Third cluster are those who develop predominantly sleep disorders, cognitive disorders, and pain. This business of fibromyalgia, generalized pain, because guess what? It turns out that fibromyalgia is a neuroinflammatory disease. So in these individuals, we see a lot of problems with unrefreshing sleep. We see a lot of problems, low rate of POTS symptoms, probably only about 3% of that population. But we do see a lot of problems with migraines and fibros, more so than we see in the cluster 2 category. In cluster 4 are mild symptoms. They ain't quite on their game. They're off a little bit. They can't quite keep up in sports the way they used to. They're finding themselves fatigued a little bit faster. And so you see there's a whole spectrum that can occur here. And if you're not familiar with treating COVID, you're not understanding the number of places and the ways you have to take this apart. So in some people, simple problem, it was in fact COVID. The sole problem, get in there, treat it, go away. In other people, it becomes a much more complex problem. And you've got to be prepared to address this with a lot of conventional and, if you will, complementary and alternative therapies to get the best possible results. For instance, there's evidence demonstrating that using nicotine patches can in fact help dislodge the spike protein from some cells and help some of our patients recover. So you've got to be with somebody who truly understands this disease and has lots of tools in their bag in order to be able to treat it, but also understands that this disease may be the end result of a lot of other processes that have been going on in your body, and be prepared to address each and every one of those in order to return you to optimal health. I think now we're about ready to head on to Q&A, yeah?
Yep, perfect timing. So before we jump into that, just announcing again that we are doing a bit of a giveaway today. We have 2 autographed books by Dr. Gary for Why You're Still Sick. So we have a grand prize of a bag. You'll have the book, you'll have a Foundation for Total Recovery mug, a pen, and some other goodies. Second prize will be the mug with the book and a pen. Some other little goodies, and then third prize will be a mug and a pen, because who doesn't need another coffee mug? I have like 80 million. So if you'd like to participate, just raise your hand by hitting the icon on the bottom of the screen. I will announce winners at the very end. I'll be messaging you directly at the very end, so stay put if you'd like to get your prize so I can get your information from you. So I see lots of hands going up, so I think we can go into Q&A. So we had some pre-batch questions that were emailed to us. And again, if you want to join us May 20th, when we send out the information, you can also go ahead and send us your questions then or in the chat now. So let's go ahead and get started. So we had one from email. Are brain fog, fatigue, and anxiety signs of long COVID? I know we talked extensively about brain fog, fatigue, and anxiety, but but not so much as an anxiety. So Nidhi, do you mind exploring a bit more about that?
Sure. So yes, those are all signs of long COVID. And what's really interesting is, there's fatigue, and there's some patients that will describe it's just, I feel like I'm wearing a weighted blanket all day. And so it's just an unrefreshed sleep, and they just feel tired all the time. There are other patients, however, that, like Dr. Gary said, that will do, some kind of an activity, either cognitively or some physical activity like cleaning the house or running an errand. And afterwards, they have this like this need to lie down and rest for sometimes hours, sometimes an entire day. That's called post-exertional malaise, PEM, and that's a very uh, it's a very popular kind of symptom that patients complain of. Patients also have anxiety, and that's because the nervous system is dysregulated. COVID is a neuroinflammatory process, and oftentimes this gets unregulated. So even though they say, well, in the past I've had, anxiety when I fly, now they have anxiety in other situations that are kind of unpredictable for them and seem out of proportion. So those are definitely signs that something else is going on, and that treatment can help or, kind of resolve a lot of those symptoms. So it's a good question.
Awesome, thank you. All right, we have another one. Are there any suggested therapies for lost or diminished sense of smell and taste, Dr. Gary?
So the loss of diminished smell and taste was much more common early on in the disease with the Delta variant. And we've seen it less so with Omicron. Nevertheless, it's quite annoying and actually can be debilitating for people who have experienced this. It turns out we originally thought that there was damage to the nerves in the cribriform plate. The cribriform plate is where how you smell. It's all the way at the top of your sinuses in this area. And there's a bunch of nerve endings that come down, and it picks up different odors and tastes and transmits them to your brain so that you can sense them. We thought originally that the damage was to those nerves. It turns out from more recent research that the damage is to the connective tissue surrounding those nerves and not damage necessarily to the nerves themselves. So our original treatments, where we were using some of the anti-seizure meds to help with healing of the nerves, were not being as effective because we weren't treating the right target. Now, what do you do in order to treat the damage around the connective tissue itself? And the answer is we have a challenge here. Now, we have used an experimental treatment, and understand this is experimental. This has not been proven, using exosomes intranasally. Exosomes are little particles that are secreted by most of the stem cells in the body. And so we have we get use of those through a supplier where we can actually buy exosomes. And we'll take exosomes and insert them up into the nose via nasal cannula. It's an annoying but otherwise painless procedure, very rapidly done in the office. We've seen a percentage of people recover from those. We have not done the study, so I can't tell you any real numbers, but we believe it's been effective for a number of our patients, certainly a number of our patients do. But otherwise, we really don't have a lot of good treatments for that. Fortunately, in the majority of those people over time, and that time may be as much as a year post-infection, they do recover. The other fortunate thing is we see far less of it now with the newer variants of this than we did in the early ones.
Yeah, thank you for that. I think that's a huge misconception that's slowly evolved. So great answer. So next I have one for Nidhi that I think is really interesting. Is the microbiome affected by long COVID? Do probiotics help deal with long COVID symptoms?
Yeah, so it is pretty common for patients to tell us that, they might have some, digestive issues before, but COVID seemed to make everything worse. And yeah, it does, COVID-19 virus, different strains affected different types of issues and inflammatory processes in our gastrointestinal tract. So it does get altered quite a bit. So we do some specialized tests. We do stool tests, breath tests, urine tests to really understand what the body needs, what the body's excreting. Are there, what is the diversity of the microbiome? Because oftentimes if we have less diversity of the good bacteria, oftentimes inflammatory processes continue and get worse. So we have a couple of different tests to be able to see what's really going on with the inside of your body. Yes, if you're constipated, you can take a stool softener, but we actually want to figure out why are you constipated, get down to that root problem, because we don't want you to have to take medications every day to have better digestion. So, probiotics are really helpful. They're not a magic bullet. However, so we have to kind of look at the whole person. We work with a very talented nutritionist. She'll go through and make sure you're getting everything that you need after looking at these tests, and really works with you. So there are some patients that have developed more food sensitivities after having COVID. And so those are times where we really have to look at what's bothering a patient. And a lot of this, as Dr. Gary says, is listening to the patient. 99% of the time, the patient knows what's going on with them. We just have to really do a really good job of listening to be able to order the right test that's appropriate for them. So yes, the microbiome and probiotics are really important. It is one piece of the puzzle, but that we have a lot of luck, and we work really hard to get patients' stomach back to where it needs to be.
Great, thank you. All right, so Dr. Gary, I know this one's probably going to get you excited. What connections do you see between long COVID and Lyme disease?
So I think the long COVID actually becomes potentially the final straw that breaks the camel's back in the whole game of Jenga. So we see people who have had Lyme disease, and I want to get a clarification on Lyme disease, okay? Lyme disease we talk about as Borrelia burgdorferi, which is the spirochete that causes Lyme. But Lyme disease is really tick-borne diseases. So tick-borne diseases can include Bartonella, they can include Babesia, they can include Anaplasma, ehrlichiosis. They can cause other rickettsial diseases. I mean, so the fact of the matter is we lump everything under Lyme, but there's a number of tick-borne diseases that really can be at play here. And that's one of the reasons, by the way, for persistent Lyme syndrome is because, or post-treatment Lyme syndrome is, well, okay, maybe you got Lyme and you treated the Lyme and that's all lovely, but you missed the Bartonella and you missed the Babesia and you missed fill in the blank. So you fail to treat the full spectrum of tick-borne diseases. So when you're talking about Lyme disease, we're really talking about tick-borne diseases. And you've got to be prepared to address the full spectrum of those. So now you've got Lyme disease, quote unquote, tick-borne diseases, which is already attacking your whole system. And it's astonishing how many people have been walking around with subacute infections. And then you get COVID, and then the next thing you know, the whole thing falls apart because your immune system was never ready to handle it. So here's the confusing thing. We used to think that in infectious disease, one bug, one disease, end discussion. So strep throat, done. You treat the strep and you're done with the infection. The problem is, which we've learned, is that the bugs can set off the immune system. And so when the bugs set off the immune system, in the case of strep, they set up things like scarlet fever. They set up problems with kidney disease. So, and now we know, thanks to the work of Janet Suedo at NIH, that they cause PANDAS, okay? This pediatric acute onset neuropsychiatric disorder as a result of strep. And these kids get really, really sick. Well, guess what? Unfortunately, this process is not unique to strep. There's a whole series of bacteria and viruses that can do this, Lyme disease being one of them, COVID being another one of them. And certainly if you have Lyme disease and you have other tick-borne diseases and you get COVID, they can reoccur and reflare. So you've got to be prepared to treat across the board in terms of what's going on with these individuals. So Lyme disease needs to be treated as Lyme disease. Borrelia needs to be treated differently than Babesia, which needs to be treated differently than Bartonella. And so while there's some overlap to treatment of those, you got to go kill those bugs. You also then have to see if you've still got COVID sitting in the system, you got to go kill that bug. And then you've got to look at the immune system and how that has responded and whether or not that's been damaged. And sometimes it's a whole backup and going, well, wait a minute, do you also have mold toxicity? And there's a high percentage of people, unfortunately, we find who have mold toxicity. Where are you getting mold toxicity from? Well, genetically predisposed. It's about 20% of the population. You don't make the enzymes necessary to break down the mold toxins in your liver. And then secondarily, water damaged buildings, most common place for mold. And it's interesting, though, because we have spouses, okay, who one person becomes deathly ill being exposed to a house with mold toxins, and the other one doesn't get sick at all because genetically they just take care of those toxins, so it's not a problem. So everybody gets treated as an individual. Everybody has to be treated differently, but you've got to have high suspicion for these diseases to test for them and see whether or not that's a problem. I see there's one question here about what testing to use for treatment for diagnosing Lyme disease, and that's a challenge and very controversial. I will tell you that Quest and LabCorp, if they're positive, you got the disease. I will also tell you that if they're negative, it's a flip of a coin as to whether or not you have the disease because those tests are fairly insensitive. I think there are a couple of labs that are much better at diagnosing these diseases, which we find much more consistency in. We tend to use IGeneX. I have no financial involvement with any of these labs, but we tend to use IGeneX located out in California. There's a couple of other labs, but consistently we end up back with IGeneX ourselves. Other people have favorability for other labs. So high index of suspicion, a willingness to take a very comprehensive history. Our intakes are an hour to 2 hours long. Okay, you can't do this in a 15-minute interview with somebody. You need to be able to sit and listen and get a full comprehensive picture of what's going on with somebody to understand what it is happening in their lives and what needs to be addressed. And so high index of suspicion, proper testing with reliable labs in order to be able to help you get a design on a path for total recovery.
Great. I knew you'd get excited. So thank you for that. This one for Nidhi. Does long COVID create insomnia, and what are some treatment options?
And we know that during sleep is when you restore your body's functions and allows you to dream and does a lot of repair. So yes, I mean, oftentimes patients will say, no matter what I do, they struggle either with falling asleep, staying asleep, and their quality of sleep. And it makes sense because COVID is a neuroinflammatory process, and it normally seems to attack the area in which the sleep-wake cycle is determined. So if you have neuroinflammation in that area, oftentimes you don't have a normal circadian rhythm. it affects the autonomic nervous system as well. So that time in which, your body is supposed to calm down and, and kind of down regulate, to be able to fall asleep, that's been compromised. So your body is just always revved up. You don't have that natural like letdown of of your nervous system to be able to do it. So for us, we want to test. We do a sleep study that you take home oftentimes for patients. We want to rule out sleep apnea or upper respiratory syndrome. We also want to see, what happens when you're actually, this data is amazing because we can see, when you wake up, what were you doing? Were you in REM sleep? Were you laying on your left-hand side? So it gives us a lot of insight. And then from there, the history says a lot. What have you tried in the past? Are you waking up because you're in pain? So there are things that we kind of target. So oftentimes we use a couple of different things depending on what type of sleep disorder it is. We can start off with using, magnesium, taurate, low dose naltrexone is something we oftentimes use, as well as melatonin because it helps with sleep, but it also is a anti-inflammatory for the central nervous system. So there are also a lot of things that we can use, as well as, what's your blood sugar doing in the middle of the night? Are we having low blood sugar and then you're waking up? So we do kind of a comprehensive look at sleep because our goal is if you sleep better, your body's going to start healing on its own. So taking your body overall to see what we can do to help with that. Or are you going through menopause? Oftentimes, these they're coexisting with long COVID. And so, going through this extensive history with you and having you be, open and honest and being willing to talk to us all about your issues, that's really how we tackle all of it.
Great, thank you. It's interesting that it can create fatigue and sleep issues. So definitely a lot there. We have about 12 minutes left for Q&A or so. So want to do one more question that was good and then move into our chat because we have a lot of good ones there. Dr. Gary, this was also kind of in the chat as well, but how does COVID cause POTS and what can be done to reverse this damage?
Yeah, so again, one wants to think in terms of genetic susceptibility for a lot of these people, especially if they have EDS. Real simple way, so EDS, Ehlers-Danlos syndrome, real simple way to test for EDS is called a Beighton score. Can you take your thumb and bring it back to your wrist without screaming and creating a great deal of problem? Maybe you can do that. Can you take your hand, lift it up flat on the table and get your little finger to 90 degrees, again, without creating lots of breakage and screaming. People with EDS who have stretchy things can, and EDS, think in terms of the contortionist that you may see at a circus. That's EDS, that's Ehlers-Danlos. And there are 12 subtypes of it. But the most common is hypermobile, that's about 85%. And so can you hyperextend your elbows past 90 degrees? Can you hyperextend your knees? Can you get your hands flat on the floor without bending your knees and doing that? All right. And so if that's the kind of stuff you're scoring, there's a high probability you have EDS. So EDS is one of the things that's frequently missed and needs to be screened for. And again, there are multiple subtypes, but the hypermobile type is in that category. So you want to, and now I've forgotten the original question. Where was your original question?
It was how long COVID can create POTS and how to go about treating it.
So one thing is, are you susceptible in terms of having something like EDS for development of POTS? But basically POTS is a dysautonomia. It's an imbalance in the sympathetic and parasympathetic nervous system, right? So the sympathetic nervous system is fight or flight, right? Heart pumping, eyes dilating, time to run. The parasympathetic system is rest and digest. Things quiet down, your digestive system is focused on digesting the food that you've eaten. So what happens with the dysautonomia is several things. One is your ability to regulate your blood pressure, more importantly, your pulse becomes disrupted. So you have a dysregulation in terms of the nervous regulation, controlling your contraction of your blood vessels. Because when you stand up, you have to contract your blood vessels in order to keep the column of blood going to your head. If the nervous system doesn't do that properly or fast enough, you're going to fall down. The second thing, however, is it can cause gastrointestinal problems. IBS, right? Irritable bowel syndrome, problems with constipation, digestion, problems with diarrhea. And so you see the dysautonomia occurring on both in terms of cardiovascular stuff and in terms of gastrointestinal stuff. But you can also see it in terms of sweating, which is also regulated by the autonomic nervous system. So what happens is COVID can influence the nervous system either in the brain itself, in which case then you're getting fatigue and sleep disturbances and depression and anxiety disorders. It can do a subsection of the nervous system, which is the autonomic nervous system, okay, controlled by the hypothalamus. And in that case, you see much more symptoms in terms of POTS or in terms of other dysautonomias that we just talked about. And it can also damage the peripheral nervous system. So where you can see loss of sensation in your hands and your legs, you can see problems with restless leg syndrome occurring in this. So there's a variety of ways in which the nervous system can be damaged in part or in whole as a result of this bug.
Great, thank you. All right, so we have a question here. Does long COVID follow a typical arc? So it seems like someone has a loved one that got vaccines and nothing seemed wrong, but it wasn't until about a couple months later or so that exhaustion and headaches began. So they're not sure if it's long COVID. So is there any kind of like specific arc or occurrence that can indicate that it is long COVID? Nidhi?
Well, that's an excellent question, because if something happened and then several months down the road you have symptoms, it's hard to kind of pin it back. We do oftentimes see this. We do see that, the initial infection wasn't that big of a deal. And then, a month or two later, they start having, after a workout or something like that, they have some post-exertional malaise. It is very typical for that to happen. So there's an initial infection, and then what ends up happening later is that the body, there could be, as Dr. Gary said, there's a lot of data showing that there's residual virus, and it's oftentimes in the intestinal lining of the COVID-19 virus. So your body, if you have this residual virus there, your body is attacking it. The body senses its presence. So patients oftentimes have, very little symptoms, no symptoms, and all of a sudden start getting symptoms weeks to months later after the initial infection. So that's a good example of someone that should come in and get evaluated.
Great,
Dr.
thank you.
Gary,
If
anything
I
else?
may, let me add to that. That's an excellent answer, Nidhi. But I also want to address the issue of post-vaccination problems. Does post-COVID occur after vaccination? And the answer to the question is yes. Look, vaccinations all have a percentage of risk with them. And it's not just COVID, it's the influenza vaccine, it's every vaccine we have. There's a percentage of people that don't do well with it. Relative to what we see with the bug itself, it's a small percentage. And the reality of the matter is you've got a genetic susceptibility that when we give you the vaccine, things don't go well. And I don't think it's a function of the messenger RNA vaccine versus the killed virus vaccines. I think the reality of the matter is any vaccine can, certainly we've seen it with flu vaccines, development of things like Guillain-Barré, chronic fatigue syndromes after some of these post-vaccination syndromes. So post-vaccination problems do occur, okay? The vaccination itself does not cause the disease, cannot cause the disease. The vaccination itself is safe and extremely effective for the overwhelming majority of people. Indeed, if you've had a vaccination, it will significantly reduce your risk of developing post-COVID. So I think that you need to see the vaccine in context. It's a very low risk, very high reward medication to receive. And so we encourage people to see it. But do we see people who have been damaged as a result of receiving the vaccine? Unfortunately, yes. There are a small percentage of people that get vaccine-induced problems. So we want to emphasize the fact that vaccines save lives, that vaccines are highly effective for the overwhelming majority of people, that while it may not completely eradicate your getting the disease, it should help you get less intense of a disease. And it should also, the evidence now is that 15% at least lower risk of developing post-COVID. Now, let's talk about one other thing. If you get COVID, my belief is that you should not only be given Maraviroc, but you should also be giving metformin. What's metformin? Metformin is a medication that's typically used for diabetes. Okay, it helps lower blood sugar. It's called an mTOR, so it modulates the acquired immune system. Why is that important? Well, it turns out that if we give you Paxlovid and we give you metformin for 10 days, Paxlovid for the 5, metformin for 10 days, we reduce the risk of developing post-COVID by 85%. Okay, so in our practice, we believe that treating acute COVID, we treat both with Paxlovid and with metformin, because we believe, again, according to the literature, that we're helping protect people from developing post-COVID to begin with. So there's a lot of data on that. It comes out of the findings that early on in the disease, that people who were on metformin for their diabetes had less severe disease, less time in the hospital if they did get bad disease. And so that's one way to help prevent the occurrence of post-COVID.
Great, thank you. A few more minutes. So someone said that they've completed a long COVID antiviral treatment, but they're still having symptoms such as fatigue, dysautonomia. Sorry, I said that wrong. Yep, thanks. And brain fog. Is it sensible to recheck cytokines? So, Nidhi, I know I've heard you talk a lot about cytokines.
Yeah, I mean, it depends. I mean, if they've already had the cytokine test, depends on when that was and what treatment they had. But it certainly sounds like there's something else going on. So a cytokine panel would be really helpful, but also just maybe an investigation on some other things that might be helpful as well. So I think it's a combination of things that they would need to do, and you know, kind of a little bit more investigation.
So let me also add to that, we are on the cytokine panel, we're focused entirely on the innate side of the immune system.
Right.
Okay, so that's damage to the non-classical monocyte. Important and true in a high percentage or a percentage of people. There is the acquired immune system, where you actually build antibodies to your own tissue. So this is a process whereby the immune system ramped up to kill the bug. In the process of doing so, there's a mistaken identity that occurs where the immune system says, you know what, that tissue, and it tends to be your brain, unfortunately, looks very similar to the bug in terms of proteins. So we're going to go after that also. So now what's happened is you have an autoimmune process that's attacking your brain. So while it's fine, we got rid of or addressed the cytokine component of it in terms of the peripheral, if you will, innate system, we still haven't addressed the issue in terms of the autoimmune process if that has occurred. And so testing for that with something like a Cunningham panel will help give us an understanding as to whether or not we've got more extensive immune response and damage that we have to be addressing. And so again, don't get locked into one test. This is the answer. This is it. If this one test provides the answer in the treatment protocol, cool, we're in, we're done. We don't need to do more. But you've got to be prepared to take a much more extensive look at other things that may have happened. And those are antibody responses, and that's a more complex treatment protocol. But it's important that we put the whole thing together because you're still sick. So we need more testing to figure out what else is going on.
We have a lot of tools in our toolbox. So if you're still having symptoms, it's something that we want you to be able to communicate to us. And as Dr. Gary says, then we look at some other testing options.
Great, thank you. And then we have another question here. does long COVID impact thyroid levels for patients with existing hypothyroidism? So no one, who wants to take that one?
So the short answer to that is it certainly can. Long COVID can induce a thyroiditis and inflammation of the thyroid gland. You can induce hyper or hypothyroidism as a result of the COVID infection itself. And so, yeah, you may have excited an autoimmune disease on the thyroid gland as a result of COVID, and that needs to be addressed specifically.
Great. And then we have another question here. Is long COVID a possibility for patients with existing gut issues like GERD and gastritis?
Yeah. I mean, all of, COVID, again, we know that the virus oftentimes lives into the intestinal lining for a period of time. And so, even if patients had symptoms before, oftentimes they get worse because COVID is an inflammatory process that happens. It also, because of that, it's either because the virus itself is residually there, or as Dr. Gary has said, your body starts recognizing that something's off, and there is, the gut biome, but the gut microbiome can be thrown off quite a bit because of it.
And
So
the other thing that can happen is if you have a dysautonomia, right? So that if you already got IBS and now you get COVID, okay, and now what can happen is a disruption already of worsenings of the autonomic nervous system and your symptoms of IBS. Nidhi is exactly correct. We have studies demonstrating the persistence of the bug in the gut microbiome. And again, addressing that perhaps with a more extended course of Paxlovid or other therapies may be necessary.
Great. I think we have maybe time for one more, maybe two if we can squeeze it. But how do you reduce the spike protein in your body if the levels stay too high and do not go down?
I'll go. The problem with measuring of the spike protein is we don't know what we're looking at. Okay, so once you've had it in your system, how much of it is there per testing and how much of it is there persistent and a problem, we don't know. So the measurement of the spike protein in and of itself is not a useful piece of information to us at this time, unless we're looking at very specialized testing, very specialized tissue. So the amount of spike protein in your system doesn't actually translate out to much information that's actionable. Always a challenge for us. So I know people like to do that testing. I know people look at that test and they go, I've got this. And the answer is not necessarily. So the spike protein may be there after the messenger RNA vaccine. The spike protein may be there after the COVID infection itself, but its long-term clinical significance is, as of this moment, completely unknown, and no one's been able to find a correlation between disease and the amount of spike protein in the system.
Great. And then if we can answer this one quickly, and then I'll go ahead and wrap us up. So someone asked about any treatment or suggestions for post-exertion fatigue besides just doing less or planning to rest after activity.
Yeah, I mean, that's a tough one, and it requires patience and pacing. So, we do, we first want to build up your cells, and so that makes sure your vitamin D levels are where they should be. And using glutathione, we do that either by supplementation, by a vitamin, or we can do IVs to target this as well. We do NAC, which is also the building blocks of glutathione that we also encourage patients to take. So those are some ways to do it, but also breath work. And, we try to pace you and to build up your metabolic function regarding that. And also, just kind of looking at you as a whole person to see what other things are going on. Because the more energy you expend, if you constantly have chronic sinusitis and you spend a lot of energy trying to fight that off, your body has only a certain amount of energy. So we try to, do that as well as, attack your sleep and make sure things are more restful. We use a lot of medications and other type of meditative practices to help with patients with that. Dr. Gary, any other thoughts?
Yeah, so I was on the advisory committee for at Health and Human Services for MECSF for 4 years. This business of post-exertional malaise is extremely important and extremely complicated. The first thing and the last thing you should do is push through it and try and do an exercise program in order to build yourself up. It's just not going to happen. It turns out that probably we're looking at a mitochondrial problem, and there are ways that we can things to help in terms of both supplements and IVs that we can do to help in terms of addressing the mitochondrial dysfunction. There's also some medications, but post-exertional malaise is a very complex problem. It's a real physiologic problem. And pacing, not pushing, as Nidhi was talking about, is kind of the mantra around here. I don't want you pushing through it. And again, you can experience post-exertional malaise simply by over focusing on something for a short period of time. I had one kid at a point that I was working with, we couldn't have him read for more than 10 minutes before he'd crash for several hours. So we back off. Now you read for 5 minutes and you have enforced rest for 20 minutes. And then we see if you can read for another 5 minutes. And we slowly were able to build him up as we were doing treatment. Okay. So keep in mind, this is not just the function of conditioning. We're also testing to see how our treatment's working as to how much more he can do. And as we've accomplished that over time, we got up through high school and he ended up, he's graduated Baylor recently. So we've seen a lot of success managing this post-exertional malaise stuff, but it is a complex problem, and it's not a matter, and the last thing you should do is push through.
Great. That definitely brings us to the end. We're a couple minutes over time, so I'm going to launch our closing survey. Thank you both. That was really informative, and hope everyone else got a lot of their questions answered. So I just put up a closing survey, if you don't mind filling that out for us, just so we could better optimize these webinars for the future. If you have any feedback of how we can improve, or if there's another topic that you want us to cover in the future, please put that in the survey while I announce some of our winners here. So announcing our winners and putting them in the chat, if your name is included, just please send us a message. Again, it's just going to be, I'm not going to do anything crazy with it. Your mailing address, email address, if you'd like as well. So our grand prize for the big goodie bag with the mug and the book and all the things is Mick. So Mick, if you could just go ahead and message me your information, I will be sure to send that out to you this week. Our second prize is Lucette. And then third is Terry. So thank you guys again for joining us today and your questions. And we want to thank you. And again, if you didn't have your question answered today, or think you have some more serious things to ask, more pertinent to a specific situation that you're currently facing or a loved one, please give us a call. Don't be shy. We have nurses and excellent staff that's here to help you, or at least point you in the right direction if we're not able to help you. So please give us a call. Also, again, this is hosted by the Foundation for Total Recovery. We're a 501c3 nonprofit. We are aimed at just specifically helping the medical field better understand these things. So you have more and more doctors out there that can be able to understand your conditions and not dismiss you. Putting that link in the chat as well. But again, thank you again for your time today. And we hope that you have a good rest of your day and live in good health. Thank you.